what role is the government ought to be playing in changing the incentive structure and moving toward both more social determinants and perhaps even more of a managed care model? What do you think the solution is here, Marty?
Gosh, you, I'm sure, have more insights on this than I do, knowing all the wisdom that you have from healthcare. But I'll share with you my observation is that affordability is an access path. And as a matter of fact, it's the number one way to increase access and tear down barriers that we see with the social determinants of health. And so we can keep throwing good money after bad into this system. And, I open the book by showing how doctors just around the U.S. Capitol building within miles are putting unnecessary stents in leg plaques that don't meet criteria, but they know how to game the system, and Medicare is paying for all of it, to show that we can keep throwing money into the system, or we can start to get wise about using what I call appropriateness measures. That's a big project now that my team and I are doing. How do we identify practice patterns of appropriateness and maybe replace pre-authorization with gold carding providers that fall within those boundaries of normal variation? Practice variation is good and healthy within boundaries. And it turns out that when you talk to experts, they will tell you, the docs will tell you in that narrow specialty, this is a pattern that's outside of the boundaries of reasonable. It's a pattern that's indefensible. It's a pattern that's a byproduct of our fee-for-service system.